Okay, well, talking about that, what I never did ever vaginal, never did it at all. I notice a difference. You know, like a trampoline, if I have a little pee going on, like, or if I'm too excited in a concert, I damn it. Okay? So I know I have like a collagen condition too, but that on top of it. But so I guess what's the normal aging process? Because I can't relate my issues to birth, right?
Yeah.
So there's still a normal aging even if I never delivered or never had a kid, never been pregnant. So what's just the normal aging of the vagina in general?
We start losing collagen very early, unfortunately. Probably as soon as you hit 30, you've hit your peak of collagen and you start losing some.
You lose 1% after 25 years old.
25.
25.
Man. Yeah.
So you start noticing it like 30, but it's 1% loss of your...
So, and that includes your whole body, not only your face, for example. It does include also the vaginal tissues, the vulvar tissues, and yes, you will lose some elasticity, you will lose some strength, no matter what you do, just because of aging. And that could be also an area where Sparkle could help. How would you address that?
Well, again, same idea. So we can use the laser, as I explained earlier. So again, the fractional laser, the fractional CO2 laser inside the vagina that can help again with to increase the collagen, just get better tissue. The CO2 fractional laser can also be used on the outside too. So obviously we do have like the internal vaginal laser, but we can also use it on the outside. So labia majora, labia minora, to again get more tightening if you feel that the tissues are just a little bit looser and not, I guess, as tight, you know?
Yeah, of course.
And
then if
there-
you say that you start losing collagen at 25, 30, do we need to maintain and do these treatments over and over again to sort of help your collagen, or is it one and done? You do one treatment and
It is not one and done. So usually we would do 3 treatments 1 month apart, and then we do recommend doing a treatment yearly just to maintain the results.
okay.
There is also the possibility of the O shot that we offer at Sparkle, and the O shot is a PRP, so the platelet-rich plasma that we do inject in the clitoris or at the base of the clitoris, and then we do inject a little bit on the anterior portion of the vaginal wall, so underneath the urethra at a very specific spot. And then that kind of increases a little bit of the lubrication. It can help with the sexual response, and it helps with a little bit of the leakage because it provides better tissue and support underneath the urethra. So wherever you would sneeze, cough, and leak a little bit, it provides that support.
That sounds interesting.
And that can be combined with the
same time.
laser. Yeah.
Okay.
And I did it, and it's actually, surprisingly, I did not feel it. How is that possible?
Yeah, it sounds painful.
Yeah, so we do numb the area just with numbing cream.
Okay.
And then I will freeze just a little bit at the base of the clitoris. But again, it's such a small needle that you don't necessarily feel it because of the numbing cream.
Okay.
And then by the time that you do the injection, because basically you would do it. So, don't lose my clitoris. So this is the clitoris, and you do it just at the base of the clitoris. So if I remove this, basically, clitoris gone. Basically, it goes right here, and then it infuses all into the clitoris. So that's definitely to help a little bit with the sexual response. And then it's tough to see, but I would go under on the anterior part of the vaginal wall. So if I turn, I guess like
It's the bladder.
right here, so above, or I guess just underneath the urethra. This is where you would go.
Nice.
Cool.